everyone, thank you so much for joining me. Today we're going to talk about 3 must-know menopause facts. If you haven't already subscribed to my channel, please do so, and don't forget to hit the notification bell so you don't miss any amazing videos. Before we dive into those 3 must-know facts, let's discuss what menopause really is. Menopause is when there are declining levels of estrogen and progesterone in a woman's body and the ovaries stop functioning. The definition of menopause is when a woman has gone 12 full months without a menstrual cycle. Then she's officially in menopause. The average age a woman goes through menopause is at age 51, but I think it's really important to mention that women have menopausal symptoms like hot flashes and vaginal dryness or mood swings. That can happen for years prior to actually going through menopause during a period called peri-menopause. That could be a period of 6 to 8 years when hormonal changes start to occur before a woman is actually considered to be in menopause. So we really have to heed what women are saying they feel, even if they have not gone through menopause yet. The first must-know fact is that urinary incontinence is not caused by menopause. We have to remember that what is common, it does not mean it's normal. And just because a woman has gone through menopause does not mean that she has to run to the protective undergarment aisle in the supermarket and start wearing protective undergarments. Leaking is common but not normal, even during the menopausal period, and the first line of treatment should be pelvic floor physical therapy. We can treat urinary incontinence, and it's not something that you should have to live with. The second meno fact is that sexual dysfunction can be fairly common in the menopausal period. During menopause, levels of estrogen start to go down, and that can cause the tissues to thin. They lose their suppleness a little bit. The tissues can become dry and irritated, and people can also develop discomfort with intercourse. It's very important to maintain the health and the strength of those pelvic floor muscles to promote optimal sexual function as well. Another reason why sexual dysfunction can be common during menopause is because a lot of women develop hip or back pain, which can make finding a position for sex uncomfortable. Physical therapists are uniquely trained to not only treat the back and hip pain, but also to help you find positions for sex that are comfortable and enjoyable. The third must-know fact is that as women are in menopause, they lose bone density and bone mass. Research has showed that women who exercise regularly can slow this process of bone loss and hold on to their bone density a little bit longer. Losing bone density doesn't only affect the pelvic floor, it can affect the whole body, and exercise is a great way to slow down that process. Guess what? Physical therapists are movement specialists. We are trained to help women develop an individualized program that suits their specific needs to help them with a menopausal exercise program. Having a good exercise program can not only slow down the loss of bone mass, but it can help with cardiovascular function. It can help to decrease symptoms of menopause, such as hot flashes. It can help to optimize sleep and reduce stress. So exercising is a win-win, and in my opinion, a must. Statistics show that women live a third of their life in the menopausal period. It is so important that we become more proactive in treating women to optimize their health before these symptoms become apparent, so that women can enjoy their life and have optimal quality of life throughout their entire lifespan. Have an amazing day, and remember, pelvic health always has to be a total body approach.